All right, so let's look at the uh, theoretical and philosophical approaches to health policy. Yesterday, we saw that when we talk about health policy, it is about making decisions on matters that pertain to population health. And we also saw that sometimes you can have policymakers deciding not to take decisions. So we have inaction. But if they take decision, what do they actually rely on to make the decisions that they make? How do they decide who can benefit from interventions such as mosquito nets, distribution of mosquito nets, who gets vaccinated, who pays for the medical care. So we have a lot of questions that we basically look at in deciding health policy issues. So in this presentation, we are going to focus on what are those theoretical guiding principles or the theoretical foundations for making decisions in health policy, and then the philosophical concepts that underlie these health policies. You shall look at a number of them, a number of these theoretical frameworks, theoretical theories, and philosophical concepts, and we will see how we can actually apply them in health policy making, and what are the weaknesses, the strength, the weaknesses, and application of these different theories and these different theoretical frameworks, philosophical approaches to health policy. So that is going to be our area of discussion in this lecture. So like I said, decisions that are made about public health issues depend on or have an underlying theoretical framework or an underlying philosophical approach. Okay. So remember, in public health, the focus is on improving health, population health outcomes through protection, protection, and then prevention of diseases. Okay, so the things that we do in public health, they 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 are anchored on theoretical principles. Okay, so in the line of health policy, what are those theoretical principles or theoretical frameworks that we really rely on to decide on matters of public health? Like the questions I posed, if you're going to have a campaign for mosquito net distribution, who should get the mosquito nets? If it is going to be about mass vaccinations, who are the people that should be vaccinated? What about the people who refuse the vaccinations? If it is about providing the medical services, who should pay for the costs for the provision of these medical services? So these are philosophical questions, or these are public policy questions that can be answered using different theoretical frameworks. So that's basically what we do. So we are going to look at three theoretical approaches to health policy. or three theories basically. We have the first one, which is the utilitarianism theory. And then the second one is the deontological ethics. And then the third one, which is the social justice theories. So those are the theoretical approaches that we are going to explain or look at in see how they are applied into health policy. So the utilitarianism theory focuses uh, on what is morally right, what is supposed to be done, and that we are considering to be morally right should be one that benefits most of the people. Okay? Most of the people. So that is the greatest number of the people. Okay, so that is the key concept with the utilitarianism theory. Okay, it's about the public health intervention benefiting most of the people. So when we talk about benefiting, in this case, you will see the word bringing happiness to the greatest number of people, or basically contributing to the well-being of the greatest number of people. That is the focus of the utilitarianism theory. Okay, so if you have a public health intervention that will benefit only a few people, then you are not applying this theory. So what are the core principles? The first one is that what can be judged to be morally right should be based on the consequences of the action, but not the intentions behind it or behind the action. Okay, so what is right or depends on the consequences of the action itself, not what you intend. So that you can have a situation where your intention is good, but the action results into something bad. Okay. So for example, if you're testing a vaccine to see if it can help in prevention of disease, but if you have not followed the right procedures to ensure safety of the vaccine towards the people, we will not look at the fact that you wanted to help people. No, we shall not look at that. We shall look at the fact that your vaccine has caused people problems. Okay, so we look at the consequences of the action, but not the intentions of the actions. So the utility is the happiness or well-being that we look at as the goal of the public health intervention. Okay, so every public health intervention should bring about improvement in terms of well-being or in terms of health outcomes. Okay, so when we talk about utility, we are talking about that well-being and happiness that the public health intervention calls, and we want it to be the goal towards the greatest number of people. And then the third principle is what we call impartiality, which is that all individuals' interests count equally regardless of their personal characteristics or social status. So this is about non-discrimination, no discrimination. Okay, so when we talk about the majority of the people, we are not discriminating according to race, according to tribe, according to social class. No, it's about impartiality. So what does it mean for health policy? It means that um, for the interventions that we are going to to implement, or for the decisions that we are going to make on what to do, they should depend on the cost and vis-a-vis the benefits. The aim, remember, is to benefit most people. Okay, so you want to have, you want to maximize positive health outcomes for the resources shared, and therefore, to achieve this, you need to first conduct what we call a cost effectiveness analysis to be able to know that if I invest here, this is the benefit. If I invest here, this is the benefit. Okay, and then you compare, see which one is more cost effective. Okay, and then you decide where you're going to get the greatest good for the greatest number of people. Okay, so this means that it helps in prioritizing interventions. It allows you to put resources or to implement interventions that will benefit majority of the people. Okay, even if it means neglecting a smaller group with less severe needs. Okay, and then it also implies that for public health interventions like vaccinations, mandatory vaccinations or screening, you have a reason to justify them because this mandatory vaccination will actually benefit the greatest number of people. So even if you get people and you force them to get vaccinated, you see that it is of great benefit to the entire population if people are actually vaccinated. Okay. What are the criticisms? So people are saying that for utilitarianism theory, it focuses on many people in neglecting the preferences of individuals. Okay, so for you look at the majority and then don't look at individual preferences or individual rights. So that is the one of the issues with this theory. Okay, and then two is that we have been using the word happiness a lot, which is derived from the utility. Quantifying it in real life can be challenging. Okay, so it is very difficult for you to say that this brings about more happiness compared to this. So it can be a little bit hard. That's one of the issues. And then the other third problem is that it does not guarantee fair distribution of resources. Okay, so yes, you basically look at how the greatest number of people, but it does not look at those few people who can be actually worse off, the ones we are calling the marginalized, or you can call them the vulnerable groups. So this if you look at the majority, you can forget the smaller numbers of the marginalized ones, especially. So we look at the second theoretical approach, the deontological ethics in health policy. Okay, with this, the emphasis is on adhering to moral principles and duties, regardless of what happens. Okay, so for it states that there are moral principles and duties that we have to follow, and that is it. So what principles are those? We have individual autonomy, informed consent. Okay, that's basically, those are some of the things that we look at. So let's explain the core principles of deontological ethics. The actions of the actions that you undertake will be determined whether they are right or wrong not based on what happens after. So it is just against to what we looked at earlier on, which is that we don't look at the consequences of the action. The action is either right or wrong, regardless of the outcome. Whether the outcome is good or bad, it doesn't matter about the outcome. The outcome is not our concern. We are basically judging your action based on whether they are right, your actions are right, or your actions are not right. Okay, so that is the intrinsic rightness. And then the second one is universal moral law. So with this principle is that regardless of where you are, there are principles that apply to everyone. Okay, so the principles of respecting other people's rights, it applies anyway. Okay, so it is a universal moral law. And then the third one, which is the duty-based ethics. Okay, that individuals have moral duties to act in accordance with these principles, regardless of what they think is right or wrong. So regardless of what I think, the consequences could be, I have to really follow uh, what is right. Okay, so that is what we call duty-based ethics. Okay, so how do we apply the deontological ethics in the health policy? Remember, we said that the deontological ethics focus on areas to do with individual autonomy, informed consent, and then non-malpractice. Non-malpractice, which is the second point here. Those are basically the things that drive the deontological ethics. So when we look at autonomy, we are basically saying that individuals have the right to make a decision on what they want. Okay, or in regards to their health. So they have the right to refuse the surgery or refuse treatment as long as they are above 18. They are of sound mind. That is respect for autonomy. And then the other one, which is the informed consent, is that for you to really carry on with the medical intervention that you want to do, you should explain to a competent individual the benefits and the risks associated with the procedure or the intervention, such that they make their own decision on whether to accept or to refuse. That is informed consent. And then the non-malpractice principle looks at the fact that you don't want to harm people. Okay? Don't vaccinate people with vaccines that have a negative impact on health, or whose impact on health you actually don't. So that is the non-malpractice or the non-malfeasance principle of ethics. Okay, so therefore, relying on those principles as outlined in the deontological theory of ethics, for every public health policy decision that we make, we need to consider the fact that the decision does not harm people, that the people have the right to accept, okay, or to refuse, and then that there is fairness, justice. Okay, that's very, very vital. So that's the implication of the deontological ethics in health policy. the criticisms that these principles are inflexible. You can't turn them around. And if it is non-malpractice, it is non-malpractice or non-malfeasance. If it is autonomy, it is autonomy. If it is informed consent, it is informed consent. But in the real world, when you are engaged in public health work, you will see that you have what you call ethical dilemmas, where you will have at least some of these principles. You might have to go against some of these principles. Okay, so that is one limitation, that it does not really guide you on what to do in certain situations. Okay, so this is basically to say that the principles cannot work in all situations, especially the complex ones, because we actually have ethical dilemmas almost on a daily basis. Okay, so sometimes public health decisions can be quite difficult, very complex, and relying on the deontological principles may not really help because they are inflexible. So that is where you have the ethical committee to discuss some of these issues and make decisions on what to do. And then the other issue is that defining and applying the universal moral principles in diverse contexts can be challenging and may lead to ethical dilemmas. Okay, the application of these principles may actually be hard in complex situations, especially in ethical dilemmas. Okay, so these principles also sometimes conflict with other important values, such as maximizing the well-being of communities or the majority of the people, while respecting cultural beliefs. This relates to the discussion that we shall have later on collective good, public good, and individual right. And as an individual, you have a right, but the community also needs to be protected. So in exercising your rights, how do we make sure that you don't inflict harmful health issues on the community or the population? Okay, so that's the third issue there. And then we look at the third ethical theories or ethical theoretical principles to health policy. So we're going to look at the social justice theories. They are quite many, but I've picked out 4 of them. So we are going to look at 4 of them. When we talk about social justice, we are basically referring to issues of fairness, issues of equity. So how do we make sure that the decisions that we make in health policies are fair and they reflect or they promote equity? Okay, so what theories can guide us in determining whether the decisions that we make are fair or they promote equity? So we will look at the Rawlsian justice, we'll look at distributive justice, we'll look at capability approach, and the feminist theory. All these lie under the theoretical and social justice theories. These the theories that help us in analyzing issues to do with fairness and equity in matters of health. The Rawlsian justice. This one, the core principle is that people who make decisions, especially public health decisions, should not make these decisions when they are well aware of their possessions, of their social standing in the community. Okay? If I'm going to make a decision which is good, I should not I should not be focused on who I am in the society and what I am. I should somehow imagine that I don't have these things. Okay? I imagine that I don't have these things with me. So how do I make sure that I make the decision that will not be promoting issues of injustice or an unfair distribution of resources? This is like if you have if you have resources to distribute, um, if you are well aware of what you have, perhaps the decisions that you will make may not reflect fairness. And this is basically the issue to do with the veil of ignorance. Okay? Forget, be unaware of your social and economic status first. When you recognize that, when you imagine that, you will make the appropriate decision in terms of distributing uh, resources, opportunities, or burdens, whatever it is. Okay. So if the person does not know their social and economic status, they are most likely going to have to make they are going to make decisions where they promote equal opportunities, equal liberties. Everyone has equal fundamental rights and freedoms. Okay, and then the second principle, which is very important, that which we call the difference principle, which is that inequalities are acceptable if they benefit the worse off in the society. Okay, so if you have resources to share, your focus is to basically perhaps share with these resources with people who are vulnerable, who are marginalized, the ones we are calling worse off in the society. Okay, so though that is the Rawlsian justice, those are the core principles that if you forget about your social and economic status, it is very possible that you can choose to make sure that you have a justice society where you have everyone having equal fundamental rights and freedoms, and that you will also most likely make a decision that those who are worse off should be the ones to be helped. Okay, so when we apply this in health policy, it means you are focused on making sure that everyone at least has an equal access to basic healthcare services, regardless of who they are. And then the other application is that you really recognize that there are some people who have poor health outcomes than others, and therefore the focus should be on addressing the issues that they have. So you advocate for reducing health uh, disparities and prioritizing interventions that improve the health of the most disadvantaged. So we move to another one, which is distributive justice. Um, this is about fair distribution of resources and benefits within a society. So under this, how do you determine fairness in distribution of resources? Okay. So you use different frameworks to basically help us explain what fairness is. The utilitarianism or the utilitarian perspective, the one which we looked at first, something is fair, it benefits most of the people. Is that earlier one that we looked at. But some people will not say that. Okay. For example, you can't say that it is going to be fair because most of the people are going to benefit. What about those who are not going to benefit and they're actually worse off? They are badly off. Okay, so that is the limitation that we earlier on looked at. And then another angle of thinking about what fairness is the egalitarian perspective, which is that everyone should have equal share of resources, regardless of whether they are badly off or they are well off, regardless of their need or contribution. That is the egalitarian perspective. And then the third one, which is the needs-based perspective, which is that we should distribute the resources based on people's needs and vulnerabilities. Okay? People who have greater needs should be given more than people who have less needs. That is another angle of looking at fairness. So which one works for you? Which approach do you take?
Yes, sir.
Mm.
To, for me, the last one worked best because if you distribute resources without assessing the need of people, others may end up misusing, or even others will not see the value of these resources you have given to them. So it will serve no purpose. So, but if you give someone according to his need or her need, will utilize it properly and he will benefit from it. Thank you.
Okay, so you go with the needs-based perspective, which is that you give resources based on people's individual needs and vulnerabilities. Any other person? Which one explains needs? Which one explains fairness better for you? Is it the first one, which is that as long as it serves most people, that is what is fair? Or is it the second one, which is that distribute resources equally? Okay. The egalitarian perspective. So we move forward to the next slide. So the application is quite obvious. You look at if you are going to make a health policy decision, you'll have discussions on where do you post, for example, if you have 500 doctors, where do you post them? In the 10 states. And what is your justification? So you have 50 doctors, you have 10 states. Let us consider that situation currently in the Ministry of Health, in the Directorate of Human Resource. You have 50 doctors, you have 10 states. How are you going to post these doctors? Let me hear. Mm-hmm. 10 doctors, 50 doctors, 10 states. How are you going to post these 50 doctors? Uh-huh. Am I still on or am I off?
You are on, and that we were trying to reason on whether we can, how to respond on the question. But to me, as I said before, if I still use the last theory of the need as a basic perspective. That means that I have to assess in the 10 state, I have to assess in which state do we need more doctors and which one need less or which one has more skill for people. before I start distributing. But if we use the other theory, and then that's where we can divide 5. But when we assess the need, that means the number will not be equal. Thank you. That's according to my suggestion. Yeah.
All right, fine. Yes, you look at where is the greatest need. We have a problem of what you call maldistribution of the health workforce in South Sudan. Last time we had a consultant who was compiling data on the health workforce in the country. But even without looking at that data, I'm not sure if that data is out. But even without looking at that data, you basically tell some things are obvious. You generally tell where most doctors are. Whether you want it or not, most doctors are in Central Equatoria. Okay, even without looking at the data. Two, we have maldistribution of health facilities, especially the secondary facilities. Okay, secondary facilities. We have more hospitals in Central Equatoria, but again, even in Central Equatoria, we have more hospitals in Juba than any other county within Central Equatoria. So we have maldistribution of health workers and also maldistribution of health facilities. Okay, Juba alone could be having, not yet counted, but you could be having more than, I think, 30 secondary level health facilities. Okay, so that means that if you're going to make a decision on distribution of doctors, you have a number of things to look at. Okay, so you'll have the greatest number of doctors, for example, in Central Equatoria, but when they are actually mal-distributed even within Central Equatoria. Okay, so you have most of them in Juba, and you go to other counties, Yei, Kajokechi, and you find very few. And it's actually the reality. Okay, you find very few. So you have them a lot in Central Equatoria, but very few in the other different states of Central Equatoria. And then you also look at issues to do with the population. Okay, the population. What ratio do you want to achieve? The ratio of the patient population, or the patient to, I mean, it is actually the physician to the population ratio, or the physician to population, or physician to patient ratio. What are you actually aiming to achieve? So you look at the population in the different states, and you also use that to see where you will post the doctors. Okay. So if you're going to use the other principle of everyone has an equal share of resources regardless of their need and distribution, if you're going to use that egalitarian perspective, then you're going to say that we have 50 doctors and we have 10 states. Each state takes 5 doctors, and for you one sleep. That's when you use that egalitarian perspective. But if you're going to say you're going to be based on the needs-based perspective, then you're going to look at the number of doctors in each state, and then you say state X has 2 doctors, yet the other states have an average of let us say 5 doctors. So this one which has 2 has to get more to reach where the other states are. If you use that, that is the needs-based perspective. Okay, if you want to look at the utilitarian perspective, where you want to focus at the greater good, you may now have to look at where best can these doctors serve? Okay, where best can these doctors serve? For example, you will not have a doctor posted in a state hospital where almost everything has collapsed in that state hospital and the patients are not coming to that state hospital. So you post the doctor there and pay them money, but they're not really benefiting from there. Okay. Yet you can post them to another place where the doctor will see many patients. And therefore you have greater happiness for more people. That is the utilitarian perspective. Okay, so that is how it helps us in making decision about allocation of resources. And then also addressing issues of unequal access to resources because of different reasons. Then we have the capabilities approach. This was developed by Amartya Sen. It focuses on individual capabilities to function and flourish in society. Okay, it's not just about resources, but their ability to utilize them. Okay, so basically we use these capabilities approach to say that we want people to really enjoy the benefit or enjoy their lives and flourish, okay, in society. So we want everyone to be out there, okay, such that we have these capabilities. So that is the capabilities approach. Okay. So things that can enable people to flourish are the ones we focus on. So education, health, food, let us say amenities, access to clean water, environment, and things like that. These are things that will make sure that everyone is actually will function and flourish in the society. So if we use that approach, it means that we're going to struggle very hard to make sure that people have access to healthcare, to education, to having proper environment, such that they can really enjoy their lives, that they have fulfilling lives, they can function and participate. So basically, it's about addressing the underlying factors that can influence health, the one we call the social determinants of health, because they're the ones that limit people's potentials. So if you improve those factors, then you're improving people's capabilities. So that is where you have health policies that focus on making sure that people have access to affordable housing with good sanitation, good running water. They can take their kids to school, and the schools are okay. Then they have access to medical care and basically uplift their income levels. That is the capability as approach. And that is how you can apply it in health policy. Okay, so you look at, instead of focusing only on providing tertiary or even secondary medical care, if you address these things down here, the education, the access to clean water, employment, access to medical care, then you're going to have a society for people. So the individuals will be able to function and flourish. You have a flourishing society. So the next one is the feminist ethics. Here, it is about recognizing the fact that we have gender inequalities in access to healthcare. And in many areas, we have access to healthcare, political representation, participation in leadership at institutional levels, whether in academia, whether in research. So if you use what we call the feminist lenses, it allows you to see where we have gender inequalities, where we have gender disparities. Okay, so when you use feminist ethics or the feminist framework, it allows us to be able to point out these issues, these gaps, the gender inequalities, and advocate for policies that address these gender disparities. Okay, so whatever policy that um, you want to address in public health, you can use the feminist approach to really think about the impact that the health problem is having on gender, and how you can emphasize the position of women, whether it is about autonomy, whether it is about reproductive health, whether it is about issues to do with discrimination. So that is the feminist ethics. Okay, so those are the theoretical frameworks that we have looked at that can help us in making decisions on what to do in public health. Now, there are philosophical concepts that you will encounter in policies. Okay, the first one is the individual right versus collective rights. I explained this earlier on. Here I said that sometimes you have to make a decision on whether to restrict individual rights for the benefit of the community. We are calling collective rights. Okay, how do you navigate that situation? This the example of COVID-19, where if you are a contact, you're isolated. Okay, so that isolation can be against your rights, but it is being done to protect the community or the population. Okay, so it is about individual rights versus collective rights. Okay, so that is about mandate. It can arise in issues to do with the mandatory isolation, mandatory vaccination, and the public behaviors that restrict individual behaviors. Okay, I mean policies that restrict individual behavior, such as smoking. For me, I want to smoke. That is my right as an individual. But if I go to the bar and smoke where other people are, that is not right. So it is about my right, which is individual right, the right to smoke, and then the right of the other people not to be secondary smokers or passive smokers. Okay? So it's about weighing that. But in most cases, it's about making sure that the rights, the collective rights, are protected. The public good, which is that the collective people, should be protected. So the other issue is, to what extent should the government participate in health matters? It's another area of discussion where we have the one side saying the government should not participate in health matters, then one side saying the government should participate. Okay? So this kind of thinking is the one which guides the government involvement in healthcare. Okay, so you have situations where governments almost don't encourage the private sector, where it is the government's role, and the government is providing majority of the medical care to the population. And then you have a situation where you have the private and the public institutions providing healthcare. So what are the ideologies that shape this involvement? Liberalism is the first one. With this is that the government should not really do a lot in health. Leave it to other people, especially the private sector, such that you have the forces of demand and supply to determine. Okay, so it emphasizes the people making their own choices, taking their own individual choices and responsibility. So the government does not really enforce a lot of policies on individuals. Okay, so minimizes government interventions and emphasizing individual choice and responsibility. Okay, so the government does not participate much, but on the other hand, you also have issues of individual rights, individual choices and responsibility taking much. Like it's what is being emphasized. Okay, and then the other thinking is about collective communities. Okay, this is where we are prioritizing collective well-being and social responsibility, supporting government action to ensure healthcare access for all. So this is the opposite of the one we have just looked at. In the second one, which is communitarianism, which is that the government should participate more to ensure that everyone has access to healthcare. And it makes sure that there is a collective efforts to make sure that we have the well-being, the social responsibility in the society. Okay, so we have those two aspects. Should the government participate or should the government not participate? Generally, if you look at the different countries around the world, it is very hard not to have the government participate in health. Even in areas where you have a lot of liberalism, which is that the government steps aside and then looks at the other private sector doing things. The government still has to come in because there are problems that arise when you have the health sector running on supply and demand forces. These ones actually arise in terms of what we call market failures. Okay, market failures. So the resources or the markets do not really they do not really reconcile in terms of demand and supply. So you have what you call market failures, which you I think we have a lecture on that in our YouTube channel. Market failures in health economics. Okay, so the government usually comes in to address market failures that can happen when you leave forces of demand and supply to run the health sector. Okay, the third philosophical concept is the value of life. Okay, the value of life influence policy decisions. As a country or as people, what do we look at? How do we look at life? Okay, if we don't really look at, if we don't value life, then there are some decisions that we cannot really make. Some decisions become very hard for us to make. I hope you understand that. It becomes very easy for you to buy a V8 than to build a primary health care center. It becomes very easy for you to build a hotel than to build a hospital. It is very easy for you to invest in tertiary healthcare and not look at primary healthcare. So these decisions, the political decisions that are made on health matters reflect the way we perceive the value of life. Okay, so the decisions that we make if we spend more on political campaigns than making sure that we have drugs in the hospital, it's what we look. That's the value of life that we have. That's how I'm thinking about the value of life. Okay, so how can we explain these things? You can use the utilitarian perspective, the theological perspective, to explain this, including religious and cultural perspectives. How we look at matters of life and death influence the decisions that we make on health matters. Issues of abortion, it's about value of life. Issues of euthanasia, where a country decides to have a policy that allows people to end their own lives that allows doctors to end the lives of patients as long as they agree. That is euthanasia. And then we have policies that reflect the value of life in terms of end of life care, that is palliative care. Okay, if someone has been diagnosed with a terminal illness, that's the stage 4 cervical cancer, you know that their chances of surviving are very narrow. Chances that the prognosis is bad. So, do you continue to provide palliative care for these individuals who have terminal illnesses or not? Because these patients will still need medications even if they have terminal illness. So they will need the human resource, palliative nurses, palliative physicians. They will need the medications. They will need the morphine. They will need the fluids. They will need care, or bowel care, whatever care that is there. So do you allocate resources to take care of patients who are experiencing end of life? So the decision that you will make will depend on how you look at life. That is the value of life. Okay? So those are some of the implications of value of life. The way we value life has an influence on the decisions that we make, especially in allocation of resources. And then we have medicalization and technology. Okay? You find yourself in a situation where, especially in the US, where the health expenditure is extremely very high. The amount that is spent on healthcare is high compared to countries that are in a similar economic development level. Okay? The US is spending more, but having poor health outcomes compared to countries where they are spending, countries that are actually also spending less. One of the reasons is because of technology and the issues to do with overdiagnosis and overtreatment. Okay? And then the other issue you can talk about is the fact that we have many private players there. So there's a force towards profit making. So these two issues, medicalization and technology, they have an influence on what decisions we actually make. Okay, in terms of either investing more in technology, in terms of ensuring that we have equity and access to new technologies that can actually exacerbate healthcare disparities. Okay, then having new technologies that does not only mean that it can contribute to narrowing the gap, but it can also still contribute. It can widen the gap. Okay, so what approaches do you take in such situations? So those are issues that you really need to look at. So that marks the end. If you have questions,